Hello, I'm Dr. Rinku Mehra, founder of the Mehra Clinic. I have worked in many different types of environments throughout my career. I've worked in academics, in a semi-private practice model, and in corporate medicine. I have found myself frustrated with the growing demands in the traditional healthcare system. Patients have always had reduced time in the office they could spend with doctors. Doctors have historically had less time to educate their patients about their diseases. And if patients have had questions about things they did not understand, they have not been able to reach their physician directly. I have spent a lot of time taking care of patients with chronic diseases, such as diabetes, PCOS, obesity, and thyroid disease. My patients have not been empowered to understand their disease, mainly because I did not have time in the office or afterwards to help them understand their disease. The COVID-19 pandemic was a blessing in some ways. It gave those of us in healthcare the chance to innovate, to see how we could best serve our patients in a convenient fashion. I had been trying to use telemedicine for at least 5 years for patients with type 1 diabetes, obesity, and PCOS before the healthcare system fully adopted it during the pandemic. What I saw during the pandemic was that my patients with PCOS could log on to their appointments. They would never miss a follow-up. They were able to attend school, and their parents could attend work with minimal time off. Patients were so happy with the telemedicine option, and my patients with diabetes, who routinely came to see me every 3 months for appointments, could be evaluated and managed without having to travel to the office and had minimal time off from school. As a result, I decided that after almost 20 years of working in a variety of healthcare settings, I wanted to do something different for my patients and for myself. I did not want to be required to see a patient every 15 minutes or be limited to do the status quo. I wanted to be available to my patients and to improve the doctor-patient relationship. In addition, I saw many of my colleagues across the country starting direct care clinics and loving medicine again. I saw that their patients were some of the healthiest because they had appointments when they wanted them. They had access to their doctor when they needed it. I have always had a special interest in adolescent medicine. I know that this is the age group sometimes that gets lost in the healthcare system. Patients with diabetes who are transitioning between pediatrics and adult doctors often don't know where to go or how to talk to adult doctors. I wanted to specifically focus on this age group to help them take care of themselves and help them learn how to manage their diagnosis. This led me to create the Mehra Clinic, a concierge-type model of care that offers direct and personalized access to myself, an experienced pediatric endocrinologist. I specialize in care for tweens, teens, and young adults in multiple states with concerns about obesity, diabetes, thyroid, puberty, and menstrual conditions. If you are looking for such personalized care for yourself or for your child, I encourage you to learn more at themehraclinic.com, and I look forward to meeting you.